We're glad you found us here at Reproductive Medicine Associates of New Jersey. Maybe you're new to infertility, or perhaps you're looking for more choices in care. Either way, we understand. Our patient-centered care and fertility breakthroughs result in some of the highest IVF delivery rates in the U.S. and the world. Reproductive Medicine Associates of New Jersey is redefining infertility care and making it a more effective, safe, and successful experience for patients, for people from New Jersey and around the world.
Infertility is incredibly common. According to the CDC, about 1 in 8 couples do suffer from infertility.
Patients want ultimately to become a parent.
We at RMA see patients from all over, from Princeton to the Caldwells to South Jersey, Lawrence Township, all over the state of New Jersey.
We get patients from all over the world. We want them to build a family. We want them to have healthy children.
We have married couples who are experiencing infertility. We have same-gender couples that are trying to start their families. We have single women who are coming to start their family or interested in fertility preservation.
You have to take care of the whole patient. We're not just taking care of an object, we're taking care of a person.
A lot of patients come to infertility treatment feeling a very loss of control. Patients from all over the world that come here, but they still feel that they're not just a number. And the reason for that is because of the individual nursing care that they get, because of the wellness team. We're all connected in so many ways, and we all work together to make sure that that patient gets all of their answers to all of their questions they might have, gets all of the emotional support that they think that they might need through this process.
I have been with RMA for 10 years, and my nurse friends often ask me, don't I get bored doing the same kind of procedure here every single day? And the answer is no, and that's because we treat patients, not the procedure.
All of the nurses, the doctors, all of the coordinators, everyone on every team is just a family, and we like to make the patients feel as if they are part of our family.
We try to work for the patients, make sure that they're happy and make sure that they're comfortable coming to us.
Going through RMA has been fantastic. It's been a smooth process, and everyone we come into contact with, no matter if it's the receptionist or the doctors or anyone in the halls, everyone is just so welcoming and warm and sweet, and it's just a lovely atmosphere.
We look at every patient that comes to our lab as a person who desperately wants to have a family, a person who is probably taking out loans or remortgaging their house to have the finances to come through this cycle. And so we sit down and we read their entire history and try to learn what this patient has been through. And you'll see horrible stories. You'll see, tragedies that patients have gone through. And we want to know those stories so that we know what we're dealing with, so that we know if there's anything that we can do better to give them an even better chance of, having that happy ending.
The number one thing that sets RMA apart is the attention to detail and the desire to do better. And that's really, really important.
Our staff is always humbled by the fact that again, they better make their way into work no matter whether we see rain, sleet, snow, or earthquake, because the patients will always be here.
So when you look at our patient care team, really the center core or the backbone of our team is the nursing staff.
Having my own private nurse, I would speak to her at 7 in the morning. I'm a teacher, and so she would work around my schedule and talk to me early in the morning or talk to me late at night, and any question I had, I could reach out to her, and it was really a good lifeline to have during this whole process. And so to have that confidant and that person that knew what was happening and what was coming up next was just a great resource, and we still speak to this day.
You go home feeling good about yourself, being able to help those patients every day. It's nice.
You're not just speaking to someone on the phone and scheduling an appointment, you're helping them along the process.
It's very different when you try to make a baby at home the old-fashioned way, and now you're coming into a building where everybody knows your business. It can feel very distressing for a lot of people. So we have to deal with all those kinds of things to see how we can help them get through this process.
I could see how it could be overwhelming to people the first day because I walked out of there with my head spinning, but like I said, they answered our questions, and even when I called them 2-3 days later and said, I thought of this, I don't understand this, somebody was there.
A lot of people have jobs where they just punch in the morning, punch out at night, go home, and that's it. And they don't care that much about their jobs. But here, you really make a difference.
I've been doing this for many years,
and I run into patients all the time. And I could be at a school play, any school function, and I have anyone come up to me and say, "Don't I know you?" And I'm like, "I don't know." And they, "Where do you work?" I say, "RMA."
When we consider when we first started out, back in October of 1999, and we were working in a small office, basically using empty cardboard boxes as desks, I don't think any of us would have envisioned kind of where we found ourselves now in the beginning of 2014.
We had an opportunity to break out on our own and really pursue our own vision as to what a world-class reproductive endocrine department should really look like.
And in fact, we were really just a bunch of academic geeks. We were at a small community hospital in the region at St. Barnabas and grew that into a substantial program in the mid to late 90s, but felt the need to grow a stronger research component and to have a more aggressive profile in terms of implementing and developing technologies to help our patients.
Our research facility is really unparalleled anywhere else. There's no other IVF clinic that has the facilities that we do in-house to perform research and also to translate new technologies to actual clinical use. It's really a unique environment.
A big component of our success rates are based on the embryology lab. So you want to go to the best lab that you can find. And so that's probably the #1 reason to come here.
We're one of the best labs in the country. First of all, we have the resources available to us to have the equipment and the technology at our disposal that we need to be good. We have 77 incubators in our lab, which is unheard of.
Over the last 15 years here, the implantation rate, the probability that a single transferred embryo will become a baby has more than doubled. And in each case, virtually all of those technologies were developed right here at RMA of New Jersey. Many of those technologies are now used all over the world.
The development of CCS really does demonstrate our leadership because of the way we validated it. We didn't just, have a great idea and develop a great technology, which is true, but we actually did many levels of studies to validate that it was effective and safe before we began offering it routinely to our patients. So it was a very thought out and safe approach, and once we were convinced that it really worked, now we've introduced it routinely to our patients.
It's a very exciting place to work. It's always changing, ever growing. I learn something new every day.
Much of the images you see on the wall behind you in many of the publications are for truly novel things. There are many areas of our field of medicine that are simply uninvestigated. Answers are unknown. And because of that, we felt the need to go get those answers. We felt the need to develop the technologies that allow us to effectively address those questions and find ways to improve our outcomes.
RMA is a unique setting because the idea of being able to do research that's real time and then gets applied to clinical care is something that's not done everywhere.
CCS is a technology that was developed here at RMA in New Jersey. What it allows us to do is identify embryos that are most likely to succeed. So CCS stands for Comprehensive Chromosome Screening, and the most likely reason why any individual embryo won't give us a good result is because the chromosomes are not normal.
RMA feels that we have an obligation to try to advance the field. The vast majority of our patients conceive and deliver today, but there are still some who do not. The fight goes on. We're going to solve those problems.
Single embryo transfer, has been really the goal of IVF since the early days of IVF. It makes so much sense that if there's one embryo and it's good, and we could transfer it and have a singleton pregnancy, that's ideal.
Single embryo transfer means that you don't get multiple gestations. And if you don't do that, you've eliminated over 90% of the complications which accompany IVF and infertility treatment.
Putting back multiple embryos might get you more pregnancies, but those pregnancies tend to be more complicated. That's harder on mom, it's harder on the babies, it's harder on the doctors who care for them. And so we really want to do our part to limit that. By putting back one embryo at a time, we can really make a difference in a lot of people's lives.
We did not want to have twins, so we wanted to be able to reduce that risk as much as possible, and the way to do that was through a single embryo transfer. We felt that for medical reasons as well as financial reasons in the long term, that was the best decision for us.
And one of the greatest challenges of reproductive medicine is looking at a given embryo in the IVF laboratory and saying, this is the baby. This could actually develop into a healthy child, and this other embryo, which may look very similarly under the microscope, actually will never divide again and unfortunately does not possess meaningful reproductive potential.
24 chromosome screening, or CCS, is a tool that we can use to better select embryos to place back to improve pregnancy rates. So identical looking embryos can have too many or too few chromosomes in one, but not the other. But how can you tell? Well, you can't by looking underneath the microscope. CCS gives you the ability to ensure that we place back the embryo that has the correct number of chromosomes, which will ultimately lead to much higher successful pregnancy rates.
The biggest difference I've seen here in the progression of IVF is the ability to have phenomenal rates with single embryo transfer. And that's huge, being also a labor and delivery nurse and being a twin myself, knowing that there is an increased chance of prematurity, risk of mom with gestational diabetes, hypertension.
The most important thing is that we can treat their infertility and get them a baby to take home, a healthy baby, and hopefully one at a time.
I'm at the age of 35, and so being somewhat in your middle 30s and wanting to start a family immediately after we got married, we tried for about a year, and per my obstetrician and gynecologist at the time suggested after a year's time if you've unsuccessfully tried naturally, then to maybe seek professional help, and so we did that.
Age is really, really important, and I think patients don't have a good feel for that oftentimes, that as a woman ages, it's not just an egg quantity, it's also an egg quality issue. And a lot of that has to do with genetics.
Always looking at what the next thing is, the next way to improve. So although we've introduced CCS, comprehensive chromosome screening, and we've applied it and we've used it to improve our patients' outcomes, now we're looking beyond that.
At Reproductive Medicine Associates of New Jersey, we're pioneers in the field of reproductive medicine. Our groundbreaking contributions to reproductive endocrinology as a whole have been recognized worldwide and demonstrate our commitment to helping not only our patients from New Jersey, but hopeful parents everywhere.
It's really taking care of people who need our help, and that's the most rewarding part of it. It's one thing to make a great breakthrough in research or to discover a new molecule or a new way of doing something, but actually to take a patient or a couple that desperately want to have a baby and to do something to fix that for them and to make that dream a reality is really why I think all of us do what we do.
When we hire new employees, we always tell them, if you ever wonder what to do, all you have to do is ask yourself what's best for the patient. And that's always going to be the right answer.